I'm going to talk to you clearly, humanly, and in detail about retrograde ejaculation in old age, what it is, why it occurs, how to confirm it, what natural and medical measures exist, how to plan an organized follow-up, and what to do to optimize results without risking health. I will do it in a conversational format, without bullet points, explaining step by step what you need to know and what to ask your medical team. Let's start with the essential. Retrograde ejaculation happens when at the moment of orgasm. Semen does not exit through the tip of the penis, but instead enters the bladder because the closure of the bladder neck is not working correctly. This results in what is known as a dry orgasm. There may be pleasure, but no semen output or very little, and occasionally seminal remnants are observed when urinating afterward. It is not usually painful, but it can affect fertility and mood. Confirming that it is retrograde ejaculation is relatively simple and fundamental before any intervention because treatment depends on the cause. In older men, the most frequent causes are clear. Interventions on the prostate or bladder neck, such as resections or certain surgeries for prostatic hyperplasia, alter the anatomy and bladder closure. Certain drugs used for the prostate blood pressure or psychiatric reasons can relax the bladder neck and favor retrograde ejaculation. Neuropathy due to diabetes or neurological diseases can damage the nerve signal that coordinates ejaculation. And to a lesser extent, tissue aging and iatrogenic damage are responsible. That is why a good clinical history that includes previous surgeries, medication, and diseases such as diabetes is the cornerstone of the evaluation. To diagnose it, the practical step is simple but revealing. The urologist may request a post-ejaculation urine sample. The test consists of emptying the bladder, masturbating until orgasm, and then collecting a urine sample that the laboratory analyzes for sperm. If sperm appear in that urine, the diagnosis is confirmed. At the same time, a general review is advisable, including a physical exam, basic lab work with glucose, and, depending on the suspicion, hormone levels or additional tests. Do not try to self-diagnose. Post-ejaculation urine is the diagnostic test that guides everything else. If retrograde ejaculation does not cause problems in sexual life or fertility, it often does not require specific treatment. When intervention is desired, especially for fertility reasons, or when the symptom is distressing, there are two main lines of management: behavioral and medical measures that seek to restore antegrade ejaculation, and sperm retrieval techniques from the urine combined with assisted reproduction when necessary. Among the natural and behavioral measures that should be tried first is reviewing the list of medications with the doctor, because some drugs are a frequent cause, and if possible, the team can adjust the medication or substitute it with alternatives less likely to cause retrograde ejaculation. Never stop medications on your own. Improving diabetes control and metabolic health also helps because diabetic neuropathy is a remarkable cause. Losing weight, controlling glucose, and reducing alcohol and tobacco improve nerve and vascular function over time. Pelvic floor exercises led by a specialist physiotherapist can strengthen the tone of the pelvic muscles and, in some men, improve functional bladder closure. If the intention is to retrieve sperm for fertility, there are home and laboratory protocols to optimize the collection of post-ejaculation urine that are coordinated with the fertility clinic. These measures are the first step and often provide benefits without risks. Regarding medical treatments, there are medications that increase the tone of the bladder neck and the sympathetic system that participates in ejaculation. Agents like pseudoephedrine or midodrine and combinations with tricyclic antidepressants like imipramine have been used to try to restore forward ejaculation. Evidence shows that a significant proportion of men achieve antegrade sperm recovery with these drugs, but the response is variable and depends on the underlying cause. These medications are not without effects. They can raise blood pressure, cause palpitations, nervousness, or sleep problems, so their use requires medical control, monitoring, and prior evaluation of cardiometabolic risks. In older men with hypertension, coronary disease, or prostatic problems, the decision to use them must be careful and agreed upon. If fertility is the priority and the previous measures are not enough, the retrieval of sperm from post-ejaculation urine and its use in assisted reproductive technologies are very effective solutions. The clinical procedure includes preparing the bladder with specific solutions or measures that neutralize the urinary pH, collecting the post-orgasm urine under sterile conditions, processing the sample in the laboratory to separate and concentrate the sperm, and depending on the count and motility, proceeding to intrauterine insemination, in vitro fertilization, or ICSI. This approach has allowed many couples to achieve pregnancy when antegrade ejaculation is not recoverable. If that is the objective, coordination with a reproduction center from the beginning is necessary to follow the exact protocol. A plan for organized follow-up that I recommend, explained with clear timeframes, is as follows. The first appointment is for diagnosis. Confirm with post-ejaculation urine, gather history, and review medication and comorbidities. In the first 2 to 4 weeks, reversible measures are implemented. Adjust drugs when possible and optimize glycemic or blood pressure control, in addition to starting pelvic floor exercises if appropriate. After 8 to 12 weeks of these measures, the situation is re-evaluated with a new post-ejaculation urine test, and if the goal is fertility, a collection test at the laboratory is coordinated. If there is not enough improvement and there are no contraindications, supervised pharmacological treatment can be attempted for a determined period with monitoring of side effects and control of blood pressure and heart rate. If retrograde ejaculation still persists and fertility is the goal, techniques for retrieval and assisted reproduction are used. This pace allows for assessing early responses, avoiding unnecessary treatments, and prioritizing safety. To optimize results, it is convenient to combine strategies, adjust drugs when possible, improve metabolic health, adhere to pelvic exercises, and, if appropriate, combine with a controlled pharmacological trial and coordination with assisted reproduction. Communication among the urologist, endocrinologist, or family doctor and the fertility center is key. Keeping a simple record at home with intervention dates, medications, and test results facilitates decision-making for the team and speeds up the process. Adherence to the plan and patience are fundamental because many improvements require weeks or months, not days. There are risks and contraindications that should not be overlooked. Sympathomimetics and some combinations can increase blood pressure and cause palpitations or insomnia, so they are not indicated for people with uncontrolled hypertension, coronary disease, or arrhythmias without prior evaluation. If chest pain, severe dizziness, syncope, or tachycardia appears when starting a drug, it must be stopped and medical attention sought immediately. If sperm retrieval techniques in the urine are chosen, following the laboratory protocol exactly is crucial not to lose the sample. Furthermore, do not underestimate the emotional impact. The feeling of loss or reproductive failure can be intense and deserves psychological support or couple therapy when needed. In daily practice, what can you do starting today? Talk to your doctor and ask for the post-ejaculation urine test to confirm the diagnosis. Review the list of medications together, and, if appropriate, explore safe alternatives. Improve diabetes and blood pressure control if applicable. Consult with a physiotherapist specializing in the pelvic floor for a practical and safe exercise routine. If fertility is important, contact a reproduction center as soon as possible for instructions on sample collection and handling. If the team recommends it and there are no contraindications, consider a supervised pharmacological trial. Document everything and maintain scheduled follow-up appointments. One aspect to remember and emphasize: retrograde ejaculation does not invalidate intimacy or masculinity. Although it affects fertility and can generate concern, Multiple paths exist to retrieve sperm antegrade in some men or to achieve pregnancy through assisted techniques. Honest communication with the partner, education about options, and psychological support when necessary are as much a part of the treatment as drugs or procedures. You should not face this in silence. If you wish, I can transform this talk into a video script ready with timings, cuts, phrases for the consultation with the urologist, and a printable checklist to take to the first appointment. I can also prepare a version focused exclusively on the urine collection protocol for reproduction centers. Which one do you prefer me to do?